Okay, so explosions. Explosions, we see them in movies all the time.
Mm.
Big, dramatic, fiery. But today, we're going beyond Hollywood. You and I are looking at the real world. Specifically, blast injuries, something I know you've been wanting to dive into.
Yeah, definitely.
And we're diving deep into these medical documents you provided.
Absolutely.
Some really interesting excerpts from a medical text. They break down how blast injuries happen, the damage they cause, and how these cases are actually treated.
Hmm.
It's intense stuff, but incredibly important.
It really is.
So to kind of kick things off here, let's talk about the explosion itself.
Okay.
Now, I'm sure you've heard of like high order and low order explosives. I know you mentioned a lot of construction in your notes.
Right.
What's the difference?
So it's all about the speed of the energy release.
Okay.
Think of it like this. You have your everyday fireworks display.
Right.
That's your low-order explosive. Burns fast, makes a big bang, but the pressure wave travels slower than the speed of sound. Then you have dynamite, your high-order explosive. It detonates, releases a massive amount of energy almost instantaneously, and creates a supersonic pressure wave, a shock wave, that can exert a force of up to 700 tons.
700 tons. That's almost unimaginable.
It's a lot.
What does that kind of force do to the human body?
Well, it's not just the initial pressure wave. Remember we talked about high-order explosives creating a supersonic overpressurization wave.
Right.
That's only half the story.
Oh.
Yeah, so it's followed by a negative pressure phase,
Okay.
where air rushes back in to fill the void, so you're hit by this incredibly powerful 1-2 punch.
It sounds like being caught in a hurricane and then immediately sucked into a vacuum cleaner.
Basically, yeah.
No wonder the damage is so severe.
And the worst-case scenario, confined spaces.
Ah, yeah.
The blast wave has nowhere to go,
Mm-hmm.
so the pressure is amplified.
Making the injuries even worse.
Exactly.
Yeah.
Even a relatively small explosion in a confined space can be devastating.
So we've talked about the force of these blast waves, but how does that translate to, like, actual injuries? What are we talking about here?
It's surprisingly complex.
okay.
This medical text breaks it down into 5 categories.
5.
Primary, secondary, tertiary, quaternary, and quinary.
5. That's a lot. I'm guessing it's not as simple as, like, everything explodes outward.
Not at all.
Okay.
Primary injuries are the most direct.
Okay.
Those caused by the blast wave itself,
Mm-hmm.
impacting things like the lungs, ears, even the brain. Secondary injuries are from flying debris.
Oh, right.
Anything from shattered glass to pieces of the structure itself,
Yeah, that makes sense.
turning into dangerous projectiles. Given your interest in construction, I'm sure you can imagine how important this is on a demolition site.
Oh, absolutely. Makes you think twice about every safety video, doesn't it?
Right.
What about the other categories? What are those?
So tertiary injuries are from the victim being thrown by that intense blast wind.
Oh, wow.
Think high-speed collisions with the ground or other objects. Quaternary injuries are burns.
Right.
Heat from the explosion, chemical burns, even electrical burns if wires are involved.
All right. Makes sense.
And finally, quinary injuries are caused by exposure to toxic substances released during the blast.
Wow. It really is a cascade of potential harm. It's amazing anyone walks away from these things.
It's a testament to the resilience of the human body and the skill of the medical professionals who treat these injuries.
Speaking of which, this medical text went into some pretty intense detail about the most common and, I guess, deadly blast injuries. And I have to admit, the section on blast lung was particularly hard-hitting.
Yeah.
I can see why.
It's one of the most insidious injuries we see. You've got these delicate air sacs in your lungs, the alveoli.
Right. I remember learning about those in school. They're responsible for exchanging oxygen and carbon dioxide, right?
Exactly. And when that blast wave hits, it's like squeezing a balloon too hard. The alveoli get compressed and stretched, sometimes to the point of rupture. This can lead to bleeding, fluid buildup. Essentially, the lungs start drowning from the inside.
That's horrifying.
And the true extent of the damage often takes time to manifest.
Really?
A victim might seem okay initially, only to crash hours or even days later as the delayed effects of blast lung set in.
Wow.
It's a race against time to diagnose and treat it.
And it's not just blast lung, right? There are other challenges. The document also talks about penetrating injuries
Yeah,
from debris.
right.
And knowing your interest in construction, I mean, this has to be a major, major concern in those types of accidents.
Absolutely. That's something we see all too often. Imagine this. A worker near a controlled demolition, suddenly something goes wrong,
Right.
and they're caught in a blast of debris. Now, it's not just the initial impact of the shrapnel and the flying fragments.
Right.
The force of the blast can drive these objects deep into the body, carrying clothing, dirt, bacteria.
Yeah.
complicates treatment significantly,
I bet.
increases the risk of infection.
That makes sense. It's like
Yeah.
a micro explosion happening inside the body itself on
Right.
top of everything else.
Yeah. It highlights a rather grim statistic from the text, actually.
Okay.
Traumatic limb amputations and severe burns are often fatal in blast victims.
Wow.
Just shows how quickly these injuries can become life-threatening.
That's really heavy. It really underscores the seriousness of these situations.
It does. And it leads us to the critical aspect of triage and treatment.
Right.
Because in these situations, time is absolutely critical.
The document actually uses the term reverse triage, which, I don't know, that sounds counterintuitive.
It does, doesn't
Yeah.
it? But in a mass casualty situation, the goal shifts from treating the most injured to maximizing survivability.
Okay.
So instead of focusing on those with the most severe injuries who might require extensive resources,
Mhm.
first responders prioritize those with a higher likelihood of survival if they receive immediate care.
It's a difficult decision to make, but in that context, I can see how it makes sense. You're trying to save as many lives as possible
Exactly.
with limited resources.
Precisely. And that often involves what's known as damage control surgery.
Okay.
We're not talking about fixing everything right away.
Right.
It's about stabilizing the patient, stopping bleeding, preventing further damage, essentially buying time.
So it's like a triage within a triage.
Exactly.
Prioritizing immediate, life-saving measures.
And blast injuries, as we've discussed, present unique challenges.
Right.
The text mentions delayed bowel injuries as a prime example.
Delayed bowel injuries, what are those?
Essentially, the blast wave can damage the intestines, but the symptoms might not show up for days.
Oh, wow.
It's a silent threat that can quickly become life-threatening if not caught early.
So doctors need to be incredibly vigilant, looking for those hidden injuries, ones that might not be immediately apparent.
Absolutely.
Yeah.
And to make matters even more challenging, blast injuries often involve multiple body systems.
Yeah.
Head injuries, internal bleeding, fractures. It's rarely a straightforward case.
Right.
It requires a multidisciplinary team of specialists working together to address all the complexities.
It's incredible how much goes into treating these types of injuries. It really highlights the dedication and skill of the medical professionals who handle these cases.
It truly does. And while this deep dive has given us a glimpse into the world of blast injuries, it's just the tip of the iceberg.
Okay.
There's always more to learn and understand about the long-term effects, both physical and psychological, on survivors,
Yeah, absolutely.
and how we can improve our responses to these devastating events.
It's a sobering thought, but by understanding the science, the mechanisms of injury, the complexities of treatment,
Right.
we're better equipped to advocate for better safety measures, research, and support for those affected by blast injuries.
Well said.
Yeah.
And perhaps that's the most important takeaway from our deep dive today.
Yeah.
Knowledge is power. And the more we understand about these complex issues, the better prepared we'll be to make a difference.
Absolutely. Well, on that note, we're going to wrap up this deep dive. We've covered a lot of ground today, but as we've learned, there's always more to explore. So to our listener, we encourage you to delve further into this topic, ask questions, and continue seeking knowledge.
And if this deep dive has sparked your curiosity, there are countless resources available online at your local library within the medical community.
Thank you for joining us on this journey into this fascinating and often overlooked world of blast injuries. Until next time, stay curious.